Remdesivir, can you comment on it? Means what is the role and the relevance? What should be the dosage and how long it has to be given, and in what setup it should be given?
Yeah, you know, I would say that remdesivir can be helpful to people with severe COVID who are in the hospital on oxygen, you know, and it helps them get better faster and get home faster, get off oxygen faster. But it's really not been proven to be a life-saving. It doesn't really prevent death. So I don't think it's an absolutely necessary drug. If it's available, then I would give it in a hospital setting because it should be carefully monitored. It's an IV drug. It's quite safe mostly, but we do follow people's liver function tests. And it's usually given for 5 days. We did a study looking at 5 versus 10 days, and 5 is quite good for most people. But that I would not, you know, I've heard reports of it being sold at very exorbitant prices and people really going out of their way to get it. And I would say that that is not worth it. It really, if you're hospitalized, then supportive care with oxygen and steroids like dexamethasone are much more important than the antiviral.
Can you comment on from which date or the day of the COVID infection remdesivir is effective? Otherwise, it is not.
Yeah, the earlier you start, if you have severe disease, so if you have you know, less than 11 days of symptoms, then it can be helpful. And so many people who worsen between 7 to 10 days. And if you're hospitalized at that point, then starting remdesivir can be helpful. As you go further and further, then it's less and less helpful. So as you would expect, the early phase is really when you try to control the viral replication, the amount of virus you have. And later in the course of your illness is really when the immune system is overactive and really causing more of the problems in people. So at that point, things like steroids and occasionally tocilizumab in people who are hospitalized could be beneficial. But really it's that immune activation that you're trying to prevent or suppress a bit so that then you prevent symptoms.
Very rightly said. आपने बहुत सही कहा कि रेमडेसिविर तभी इफेक्टिव है जबकि वायरस का जो है रिप्लिकेशन स्टेट चल रही है. एक बार जब वो इम्यून सिस्टम को एक्टिवेट कर देता है तो हमारे पास में साइटोकाइन स्टॉर्म या इन्फ्लेमेशन जो है बहुत सीवियर हो जाता है. उस हालत में रेमडेसिविर का कोई रोल नहीं रहता और उस समय हमें लाइफ सेविंग स्टीरॉइड्स की ही जरूरत पड़ती है. थैंक यू सो मच.